A tougher set of social distancing guidelines calls for a sterner framework of legal penalties to ensure the containment efforts bear fruit. For more on this, I have Professor Sye-ryun from Kyung University. Welcome back, Professor Song.
Good to be here.
And with the social distancing in mind, I have Professor Choi Young-jun from Hallym University, which is located in Chungcheon Province, Gangwon Province, that is, joining our talk virtually. Hello, Professor Choi.
Thank you for having me.
Also, for better understanding of the situation in the US, I have Charles Krugel, a labor law attorney in Chicago, with us as well. Hello, Mr. Krugel.
Thanks for having me. Hi.
Professor Song, since the start of level 2.5 social distancing here in the metropolitan area on August 30th, authorities claim that about 1,000 cases of violations have been reported on a daily basis. What are some of the more common violations?
Well, the cases mostly relate to violations of mask rules and also what happens in restaurants. And there are some reports about the fake news, people spreading fake news. More broadly, though, I think they are symptoms that show that people are frustrated and also fatigued about this prolonged social distancing and the restrictions that they're having. Although we're not having a hard lockdown, but it is clear that there's the social distancing and the measures that have been going on for several months and probably will continue more is affecting economic and social lives. And the more frustrating thing is that people perceive that there has to be and will be a new normals, but we don't know what they are and we're not really used to it. So I think that the frustration about the uncertainties, is about the economic and pinching and social frustrations. I think they all contribute to people kind of airing out in the form of calling in to sniff on others.
Right. And in response to that, Professor Che, authorities have pledged a zero-tolerance policy against those who undermine COVID-19 containment efforts. Do you believe such a stance is necessary to ensure an effective disease prevention campaign?
So the quarantine is a very old strategy that is still a very powerful part of the public health response to the emerging diseases like COVID. So back in like 16 or 17 years ago, when there was a pandemic of SARS or the severe acute respiratory syndrome in 2003, the countries that used the quarantine, the border controls, the contact tracing, and the surveillance, all these have proved their effectiveness in containing the global threat in just over like 2 or 3 months. So we know that this practice has been the cornerstone of the organized response to infectious disease outbreaks, but we also use the quarantine and other measures for controlling of these diseases always has been controversial because of these strategies raises the political, the ethical, and social economic issues, and also requires a careful balance between the public interest and the individual rights. So I think these measures by their nature require some great attention to avoid causing unnecessary prejudice or intolerance. And I think the interdisciplinary perspective can help to clarify the use and to imply of this very valid public health strategy.
Meanwhile, outside of the country, Mr. Krugel, there have been public rallies against face masks in quite a number of countries worldwide, with protesters highlighting their personal freedom. What are some of the other acts of defiance with regard to COVID-19 regulations?
Well, we've had lawsuits in the U.S., so we've actually had politicians, elected officials suing our government, the state governments and local governments about the face mask mandates. So there's been litigation involved with that and social distancing. And then you have that coupled with the Black Lives Matters and the other civil protests or other civil protests. So it's been there's been a lot of action on that, a lot of resistance.
Professor Song, here in Korea, there have been indemnity lawsuits being filed by the government against organizations and individuals seen to have flagrantly violated safety measures to further endanger the health of the public. What impact do such legal actions have on overall containment efforts?
Right. For insurance benefits, this cost recovery for fraud or unlawful activities, they're quite standard. And in fact, in Korean laws, it's provided in the health insurance laws, and they indicate whether if there's a fraud situations or if there's a lack of report or if they don't listen to the instructions from the authorities. There are legal bases that they can be indemnified or they can be sued to recover the costs. I think that's not been done in great degrees, but there are a lot of talks about whether government should go after it. I think the overall effect is that government is trying to discourage people from violating these laws for political or other reasons. I think that people should take their responsibilities very seriously, because this is something that can spiral out of control very easily for the actions of a very small group of people.
Right. Professor Che, another trend of much concern is the spike in cases after long holiday weekends. Now, we have the 5-day Chuseok holiday coming up starting from the 30th of September, which is a Wednesday, and it will last until the 4th of October, a Sunday. Now, authorities have advised against travel and extended family gatherings during this holiday. What more can be done to ensure safety?
So I think there are two ways of concerns for family get-together or visiting their relatives and national holidays like Chuseok. So one is rather theoretical, that when we do the disease prediction using the mathematical models, the mixing of the population across the locations, like including household, workplaces, and schools, and so forth, these will all contribute in increasing of the epidemic size regardless of the different scenario. And another is our experience in beginning of the global outbreak. If you remember back in January, when there was a lunar New Year's holiday in China that just coincided with the emergence of COVID, that just spread across the country and over the borders. So I agree with the government's warning to keep ourselves from visiting families and relatives from this Chuseok. But if that is not realistic in some cases, still the standard precautions to protect yourself is the same. The keeping the physical distancing as much as you can, ideally 1 to 2 meters away. Always wear the mask, wash their hands, and especially if you're at a higher risk of becoming serious after getting COVID, it is recommended to minimize the interactive activities.
And regardless of that, Professor Song, very worried about a possible dramatic rise during the Chuseok holiday. Some are calling for a ban on travel altogether. Is such a ban possible under Korea's current legal framework?
Well, any kind of emergency situations, your basic rights can be abridged for the kind of compelling government interests. So it can be done. But we have not been doing that. I think that at this point we have kind of developed the capacity to manage the situation. So far it has been not a situation where like other countries, you have to have a very hard and draconian measures. So despite the legal possibilities of doing that, I think the more important issue is whether not only the government, but people develop this a capacity to deal with this emergency situation, not only for this pandemic, but any number of other situations that might come in a public health or other situations. So in that sense, this is a real test for kind of cooperations and also kind of a civic capacity to deal with the emergency situation that happens to be a pandemic at this point.
Right. Mr. Krugel, I understand in the US there has been a rise in lawsuits by workers claiming that they were infected as a result of their employers' negligence. Do tell us more about this, please.
Sure. We're seeing an increase in lawsuits and agency complaints with agencies like the U.S. Department of Labor and the Occupational Safety and Health Administration. So you have people who are basically filing an individual and class action both. And then also you have wage and hour complaints for continuation of wages during the downtime or furloughs or layoffs that result from loss of jobs, whether it's temporary or permanent. So there's been and we're a litigious society to begin with. So this is, it's within our nature to sue one another. So it's part of this. And we're dealing with it as best we can. I think Professor Song alluded to this before. We have a legal framework or structure or infrastructure for dealing with these issues. Part of the problem is we don't have the people power to actually execute or administer it. So.
I see. Professor Song, as part of level 2.5 social distancing in the metropolitan area here in Korea, dining and drinking establishments, including restaurants and coffee shops, have been asked to adopt the QR code-based registration to keep a log on all the patrons there. Unfortunately, it appears that the personal information of these visitors to these establishments is being poorly managed. What are your thoughts on this?
Well, I noticed it myself. QR code is a little bit better because you don't see what other people have gone through. But there are some establishments where you have a sheet of paper where you write down your name and phone number. And, you know, by definition, your location data and your personal information is right there to be seen. So in that sense, I think that we have to focus on the personal data maintenance and how we deal with it, and how they are deleted. And as far as I know, there are not very concrete and clear guidelines about how those shopkeepers have to maintain those records and when to destroy it, and so on and so forth. So in that sense, I think this is one of the homework that we have to address, because at this point, some people might be, well, it's just the name, and if you look at just the phone numbers, what can you do with it? But if you aggregate all those data, the potential misuse is still there. So in that sense, the government has to look at what kind of guidelines they can issue and what kind of normal routine can be set in the society, where if you do business, then you have to take care of the personal informations of the people and the record-keeping routines and so on and so forth.
Right. Mr. Krugel, are there any legal mechanisms at the state or federal level that seek to balance public well-being and personal freedom in the U.S.?
Yeah, there are. And like we discussed a little bit earlier, or we alluded to, we have these laws and these structures in place. Whether or not we have the people to administer or execute it is debatable. But we do have civil rights laws. We do have occupational safety and health laws. So they're in existence. We're seeing greater levels of enforcement, and we're seeing the governments trying to enforce to a greater extent. Part of the problem is that there's this push and pull between state and federal, or state, local, and federal governments in the U.S. So we don't really have much of a national policy or program relative to COVID-19 management. So the states and regions and municipalities, individual localities, have had to fill in for themselves. So that's just the way it's played out here.
Professor, I see. Professor Che, here in Korea, there is clearly some friction between the emergency powers being exercised by the government amid the pandemic and the individual rights as guaranteed by the Constitution. What can be done to ease this friction and to ensure a joint effort, perhaps, in fighting the pandemic?
So I think we are seeing a greater use of the robust social distancing measures, like closing the schools and canceling the public meetings and so forth. They also give like number of the logistical challenges and the increase in the risk of those people who are living in the restricted areas. But from our perspective of the public health, at this moment, the flattening of the curve, meaning the slowing the spread of the COVID across the space or time, is very critical at this moment. And the healthcare system just cannot sustain a massive influx of infectious disease cases to the emergency department and the hospitals. So I think counterbalancing between the public benefit in terms of their legal rights, human rights, and the right to be healthy, I think the response to the COVID requires some newer, more creative, the interdisciplinary tools from the public health side and the legal side as well. And I think in this time we need the public health law that emphasizes more of the support rather than the restriction in all matters.
Professor Song, there are individuals and businesses reportedly exploiting loopholes in the current social distancing guidelines. For instance, there have been reports of groups of people gathering or holding small gatherings outside of the metropolitan area for religious or sales purposes, both activities which have been linked to sporadic cluster infections. I suppose adjustments will constantly be necessary to better address these issues then.
Right. The loopholes have to be plugged, and that will benefit the overall impact and also effect of the quarantine efforts. However, we have to be transparent about what the situations are. I think that those people are desperate to pursue what they believe to be, in terms of religious activities. Probably some people are very bent on following the edict or their way of worshiping. I think in that sense, what is more important is whether there's the social compact or social understanding of why this is necessary and why everybody have to be pitching in. So in that sense, more dialogue, maybe there might be some debates at first, but I think that Korea has been moderately successful in being very transparent about the whole situation, letting people know what the situation exactly it is. And the expertise have been very much on hand to explain things. So I think it has to continue. And also at the same time, if people don't really cooperate, probably under the current legal framework, that a measure has to be further developed.
I see. All right, Professor Song, as always, thank you for your thoughts. Professor Che, all the way in Chuncheon, Gangwon Province, thank you for joining us live. And Mr. Krugel, all the way in the US, thank you for making the time to join us live with your thoughts.
Thank you.
Thank you.
Right. Well, that brings us to the end of Tuesday's coverage of COVID-19. Tomorrow, we bring you more on the after effects as suffered by those who have survived the infection. In the meantime, do seek to abide by social distancing to ensure your health and that of those around you. See you tomorrow.